among 15 to 25-year-olds in the past 5 years. In 2012, there was a fatal overdose from opiates every other day in Hamilton County. So if there hasn't been one today, there will be one tomorrow. That's extremely scary. I mean, my little phrase about that is, if these were dolphins in the Ohio River coming up on shore, everybody would be going crazy. Everybody would just be going, oh my God, what are we going to do about the dolphins? And we don't, and for a number of reasons. This was found today in a planter by the downtown YWCA. That orange thing is a syringe that's been discarded. Now, what's going to happen when someone goes to clean out that planter? They're going to get stuck. What could they get? All kinds, hepatitis C, some AIDS, all kinds of an infection. You know, because it's an unclean needle. They could get an infection that gets into their bloodstream. You know, this is what's happened. You may have heard some of the information about Portsmouth and everything. What brought everything to a head in Portsmouth was a 5-year-old picked up a needle, got stuck, and contracted acute hepatitis C. And so, I mean, it was an acute case. She's okay, but it's, you know, that stigma, that is going to be with her forever, unless we can get rid of it. Okay, so we've had a lot of media presence in our area. There was a City Beat article. We've had a story on WVXU. There was the week-long series in the Enquirer. Channels 5 and 12 have done lots of things. We have a Facebook page for the response to the opioid epidemic. So you all could, if you Google, and ROE, sometimes we'll get it, but response to the opioid epidemic will definitely get you. If you Google Facebook and add those words, response to the opioid epidemic, you get to our page. And there are pictures there of places where we found things and information. Yes, Adam?
The picture that she showed was posted on that Facebook page earlier today by someone who likes our page. So they were just walking, going to go work out, and took a picture and then sent it to us. So if you like the page and you can do that, that would be helpful.
Yes. So what are some of the ways that our community is already addressing this problem? Okay, we've got, there are regulations on pharmacies and prescribers, you know, about what they can do. There's the new regulations, there's the pill mill bill, that kind of thing. There's cross-border collaboration that's going on between Kentucky and Indiana, both in the ways that prescriptions are reported. So the ORS system in Ohio, the Casper system in Kentucky are talking to each other now, and physicians can pull up information from both of those. There's cross-border collaboration between the groups that are meeting on both sides. There's prevention, the drug take-back days. When we first started talking about drug take-back days, I had someone in my office, and I consider my office to be pretty knowledgeable about health, and about, I mean, I talk about prevention and substance use disorders all the time. She said to me, Ann, do you think people are going to come bring in their illegal drugs to police stations? And I was like, no. And I realized that for her, drug meant illegal, and that what we needed to be saying are things like prescription take-back days. This is to get the prescriptions out of our houses. It's also available if someone wants to take in illegal drugs. They can do that and dump them in. Nobody says anything to you. Have you taken drugs back? Is anybody in here taking drugs back?
Just did.
Where do I
Just
take
did?
them? I don't even know where to take them.
Oh, you can go to most police stations in the city of Cincinnati have a drug drop box, and you can take them in and drop them in there. And then there's a day every spring and every fall that is advertised so that you can take them to lots of different places. And they're disposed, they're incinerated. They are not put down, the last thing you want to do is put them down the toilet or wash them down the sink. It gets into our water system, it's really bad for us. It's not a good thing. None of the stuff that they do at the water treatment plants gets the drugs out of the water system, so it's really important to know that. So having prescription take-back activities is really important. And we collected at that recent take-back day, as a state, something like 600,000 pounds. It was huge. Okay, we have more medication-assisted therapy, which is the evidence-based practice for treatment of this disease, of opiate addictions. That having medication-assisted therapy with either outpatient or residential are the things that help the most. And then we've had an increased use of drug courts. So here in Hamilton County, some things that have happened. The Cincinnati Health Department declared this an epidemic over a year ago. We have developed the Hamilton County Response Group. We're meeting, there are task forces of that, meeting on a monthly basis. We just had a huge meeting on Tuesday, to which the Deputy Director of the National Office of Drug Control Policy attended and came and talked to us about what is going on from a national thing. We are working on planning a syringe exchange here in our community. Yeah.
Go figure.
Yeah, go figure that we would be doing this. There are still some hurdles. The first hurdle that we had to overcome to do a syringe exchange was to get a local health department to declare this an epidemic. That happened over a year ago. We're hoping that the Hamilton County Health Departments, Norwood, Springdale, and Sharonville, the 5 health departments that we have in our county, will also declare it an epidemic. We're hoping that they will do the same thing at the 2 northern Kentucky health departments, one that covers our most contiguous urban counties and another that covers the more rural counties out there.
Address what the importance of the syringe exchange or needle exchanges are, because it seems to be controversial.
Okay, the importance, I'm going to go one more step and say that we've also established a pilot program for the distribution of naloxone. Naloxone is a drug that gets, when you're given it, it doesn't do anything bad to you. It doesn't harm you in any way. All it does is kick the opiates out of your brain for a few period of time and say, okay, you're not sitting here, and so the person revives. They're awake. They're not happy, but they're awake. They're alive. It puts them into immediate withdrawal, so that's why they're not very happy about it. But it is a way to keep, it's one of the few drugs that we know that will reverse death if the person is caught soon enough. Because what opiates, an overdose is just, it is your body shutting down, your respiration shutting down. So we have at CCAT, there is a naloxone distribution program for the people who are coming out of there who are at highest risk for an opiate overdose. The people who are at highest risks are people who have just gotten into recovery, have just stopped using drugs, because if they go back, we know that addiction is chronic relapsing. If they go back to using, frequently they will use the same amount they used to use, and that their body has already reset its thermostat, and that's going to put them into an overdose. And the second group are people coming out of jail or prison, because they have detoxed, and they may not have any intention of quitting, but they haven't gotten any education. So we're hoping to get some things into the jail and prison as well. Okay, here's some needles in Lower Price Hill, taken a year ago, I don't know, a few months ago. Okay, so this Hamilton County Response Group has pulled in a number of people from local government, just a huge variety of folks. We need more. We're always looking for more people to join us. The Board of Health did the emergency order. We have verbal support from City Council and the mayor. We have support from other health commissioners within the county. We've had discussions with groups in Lower Price Hill. We're looking forward to the meetings that we're going to have with Westwood and Over the Rhine. We're hoping to meet with the Hamilton County Commissioners relatively soon. Here's a daycare center in the backyard near UC, and just right there. When we were at the Lower Price Hill meeting on Monday night of this week, we were told that they cleaned up a parking lot and found 66 discarded needles in one parking lot on one cleanup day. Okay. Syringe exchange is prevention, not permission. It's prevention of diseases like Hep C and HIV. It's prevention of infections like endocarditis, which is an infection of the heart and the heart valves. And all of those things are extremely expensive. A case of endocarditis can run $250,000. Now, you can run, as our friend Dr. Judith Feinberg from the Infectious Disease Center is fond of saying, she could run one hell of a program of syringe exchange for $250,000. just one case. If she can just prevent one case of this. Okay, so what does syringe exchange do, and what are we proposing here in Hamilton County, and why is it controversial? Well, we're proposing a one-for-one program. So an addict, a person would bring in one syringe, and they would get one syringe. If they brought in 10 syringes, they'd get 10 syringes. So what does this do in the community? What it does in the community is it cleans up the parks, because syringes become something that has a value to it. A dirty syringe has value. You can get a clean one. Now, addicts are not stupid. They don't want to use dirty syringes. They want to keep themselves clean. I hear people talking, addicts that I know, who talk about, well, no, I didn't. I've tried everything I could, but my disease was such that if I didn't have anything, I used puddle water to clean my syringe. If I didn't have anything else, now just think about what's in the puddles. Just think about, I mean, that's just so scary. But no wonder people get these horrible infections and the sites of their injection sites become so infected. So we want to do that. It really cleans up the area. It makes it safe for children to play in parks, for sanitation workers to do the things that need to be done, for police who are responding to an area to be pretty safe about what's going on if you've got a syringe exchange. The other thing that syringe exchanges usually do is that they do a number of other services. So they distribute safer sex materials. The one in Portsmouth, the one that we're proposing here would distribute naloxone kits. A nasal naloxone so that it can be just squirted in the nose, doesn't have to be injected or anything. It has a card in it that talks about where treatment is. It has a card in it that shows if someone is a bystander and doesn't know. It's like an AED, an automatic emergency defibrillator. I think that's what those letters stand for. And so it shows you exactly what to do. Okay, you do this, you call 911. The first thing, call 911. Second thing, put these things together. Third thing, listen to make sure what's going on. Stick this in their nose, shoot it up there, stay with them, don't leave. Gives them, this is what's going to happen. They're going to come up and they're going to be unhappy. So it does all of that. So we have kits, we've got them available, we know what to put into them, we know how to educate people. Portsmouth has distributed 102 kits for naloxone. They've had 7 saves. That's since July of last year.